Well, summer is here, and with it comes beach days, barbecues, lots of fun time in the sun. So what is the best way to protect your skin from the dangers of sun exposure? We have Dr. Mike Egerstedt. He is a skin cancer reconstructive surgeon at Rush. Thank you for being here with us today. We appreciate it. This is such a great topic, especially during these summer months. Let's talk about the Latino community in general, because I feel like that is one issue that we ignore oftentimes, the health of our skin.
It's a common misconception among the community that skin cancers are far less prevalent or not able to get skin cancers. And so that leads to a lot of patients really not seeking care when they otherwise should, or checking their skin as they otherwise should. That's exactly right.
What do you notice mostly in the Latino community? I was saying earlier that there seems to be a rise in skin cancer among the Latino community. Why is that? What's the difference between somebody who's Latino who may not be?
Yeah, we really think it's mostly related to detection in those communities, as well as people wearing sunscreen in those communities. So Caucasians and other ethnic groups have really taken to wearing sunscreen, and the Latino community has been just slower to adopt that.
Okay. And then also the second thing is that oftentimes they're not going to either get screened. Is that something that you're noticing? They avoid it altogether.
That's exactly right. They're not going to get screened as much as some other groups that were consistently considered higher risk before might be getting screened more often than Latinos, and unfortunately now we're seeing that play out in the data, as you just said.
Yeah, and so oftentimes when they find out they have skin cancer, it is pretty far along.
That's exactly right.
So it becomes much more difficult to treat it.
That's exactly right. It gets more difficult to treat, and oftentimes, as you just said, there's a delay in detection in those patients.
Okay, so let's talk about the types of things that people can do. If they're at home, they notice something, what should they be looking for, right? Because we all have sort of markings or freckles and things like that. What's something that might be an issue as opposed to something that's just benign and no big deal?
Well, there's no harm in getting things checked out, no matter how small. However, when we think of the worst type of skin cancer that we think of, it's melanoma. And melanoma, we think of the A, B, C, D, and E's, and that's asymmetry, borders, coloration, diameter, and then evolution. Is it changing over time? So if you see your dermatologist, they'll be able to look at that, they apply that criteria, and they can determine how high of a risk something might be.
And so at that point, they would send it out for a biopsy or something like that?
Exactly right. Usually a dermatologist is the point of entry. They get a biopsy, and if it shows anything, then oftentimes they'll send the patient my way so that we can perform reconstructive surgery after excision.
Okay. What should parents be doing? You know, a lot of us have kids that maybe we're taking them out in the sun, we're going to the beach, we're doing swimming activities, whatnot. So what advice would you give to a parent who maybe relies only on sunscreen, for example?
Yeah, so don't go out during the peak hours. That's the best advice I can give.
So meaning 12 to 3?
Yeah, 12 to 3, that's exactly right. 12 to 3, and especially 12. Sometimes 12 is not the hottest part of the day, but it is the highest sun exposure part of the day. And so people don't think of that when they're going outside. Of course, use sunscreen. They have really good shirts that can be worn in the pool now that are actually even more protective than sunscreen. And then, of course, anything that crops up, you want to get it checked out.
Maybe the type of sunscreen that you're buying, is there anything in particular that you should be looking for?
Just the higher SPF, you know. SPF 50, I feel like a lot of people shy away from because they want to get that nice summer tan, but SPF 50 is great. You can still get a tan over the course of the summer and still use sunscreen that's going to give you good protection.
Okay. Do you think that misconception by the Latino community is changing a bit, or at least it's evolving? They're starting to hear the message. They're starting to pay attention to the data and the numbers. I mean, to see something like there's a 20% rise in, you know, skin cancer among Latinos, that's stunning.
It is. It's stunning, and my hope is that at least part of that is the fact that we're actually detecting these skin cancers more. So my hope is that part of that is that we're actually seeing these skin cancers that we otherwise wouldn't see till much later. But in reality, we still need to get the word out among the community.
And you also mentioned to me that treatment, maybe there's not so much new information when it comes to research, but there are new treatments that can help. Talk to me about those.
Exactly. So we have much more targeted therapies now. So some of these skin cancers actually respond really, really well to certain medications that could make you not even need to get surgery, or a much, much smaller surgery for the skin cancer. So there's really exciting developments in the treatment of skin cancers, but detection still remains an issue.
So there are always options. Okay, we appreciate your time. If folks want to learn a little bit more, maybe want to get in on some of this data, or want to find out what they can do, what precautions they can take, is there a website or anything like that that you recommend that they visit?
You know, they can always go to the American Academy of Dermatology. That's a great resource. Rush.edu also has a lot of resources, and they can always, of course, have a consultation.
That's right. Okay, thank you so much. We appreciate your time.